Hello learners, welcome to lecture 41. In our previous session, we focused on social work practices in maternal and child health, highlighting the role of advocacy, counseling and empowerment. Today, we move on to a more focused area, counseling and support services for reproductive health issues. Reproductive health is not only about medical interventions, it is also involving informed choices, emotional well being, and sensitive support. Counseling enables individuals and families to navigate complex decisions, overcome stigma, and adopt healthier practices. In this lecture, we will explore the scope, methods, and challenges of counseling in reproductive health. Reproductive health encompasses physical, mental, and social well being in all matters relating to the reproductive system. Beyond clinical interventions, individual needs psychosocial support to understand choices, manage anxiety, and navigate cultural pressures. Counseling plays a critical role in bringing technical services with personal realities, ensuring that decisions are informed, voluntary, and respectful of dignity. The scope of reproductive health counseling is wide. It includes family planning and contraception, where couples need guidance on methods, side effects, and informed choices. Maternal health counseling addresses birth preparedness and danger signs. Adolescents require confidential advice on sexuality and reproductive health. Infertility counseling provides emotional and practical support, while HIV/AIDS counseling addresses stigma and adherence. These services ensure reproductive health is comprehensive and client centered. Counseling must actively counter power imbalances by gender, age, caste, and disability. So, choices are genuinely voluntary and informed rather than shaped by coercive norms. Practically, this means private, adolescent friendly, and disability inclusive spaces, unbiased discussion of benefits, risks, alternatives, and clear counter referral pathways to contraception, antenatal care, and infertility services, and of course, HIV care. Decision aids and visual flip charts help clients align method choice with life goals, while safely planning and confidentiality protocols protect those facing violence or stigma. Follow up contacts, troubleshoot side effects, reinforce adherence, and support method switching without judgment. Finally, simple disaggregated data by gender, age, caste, and disability or location should be measured, and the services should be kept client centered and equitable. Counseling in reproductive health is guided by key principles. Respect for autonomy means individuals must make their own choices without coercion. Confidentiality and privacy are vital for trust building, especially with sensitive issues. Cultural sensitivity ensures that counseling resonates with local beliefs and practices without reinforcing harmful norms. Informed decision making guarantees that clients receive accurate information to make choices aligned with their values. Counselors must actively address power asymmetries by gender, age, caste, and disability using non judgmental choices, trauma informed communication, and ensure voluntary, reversible choices. Practically, this involves private spaces, clear consent, unbiased information or benefits, and referral pathways to adolescent friendly and disability accessible services. Shared decision making tools help clients articulate values and preferences, while confidentiality protocols protect them from stigma or retaliation. Documentation should record the counseling process, not outcomes coerced by providers. and follow-ups should respect client readiness and safety. Finally, reflective supervision and periodic community feedback keep counseling aligned with rights, equity, and culturally safe practice. Family planning counseling is central to reproductive health. Clients are provided with comprehensive information on contraceptive options, including effectiveness, side effects, and reversibility. Myths and misconceptions such as infertility caused by contraception are addressed openly. Most importantly, counseling ensures that choices are voluntary and informed, without pressure from providers, partners, or family members. This empowers individuals and promotes responsible reproductive choices. Maternal health counseling includes guidance during antenatal and postnatal periods. Counselors to discuss nutrition, rest, and birth preparedness, while educating families about danger signs like bleeding or convulsions. Beyond physical health, counseling provides emotional support, helping mothers cope with anxiety, fear, or postpartum depression. This holistic approach ensures safe pregnancies and healthier outcomes for both mother and child. Adolescents, they need specialized reproductive health counseling. Services must provide confidential and non-judgmental spaces where young people feel safe to ask questions. Counseling addresses puberty, sexuality, contraception, and protection against infections. It also builds life skills such as communication, negotiation, and self esteem. By improving adolescents with accurate information and confidence, counseling reduces risks of early pregnancy, unsafe sex, and exploitation. Infertility carries profound emotional distress and stigma, particularly in cultures where childbearing defines social status. Counseling provides a safe space for couples to express fears and frustrations. Counselors guide them through treatment options, settling realistic expectations and helping with decision making. Support extends to family dynamics, reducing blame and encouraging understanding. Such counseling reduces psychosocial burden and enhances coping strategies. HIV, AIDS, and sexually transmitted infection counseling is essential for both prevention and care. Pre and post test counseling prepares clients emotionally, explains results, and links them to services. Counseling emphasizes risk reduction strategies such as safe sex and harm reduction. Importantly, it tackles stigma and discrimination, empowering individuals to live with dignity while adhering to treatment. This supportive counseling strengthens both physical and mental health outcomes. Sexual health counseling promotes safe, respectful, and fulfilling relationships. Counselors address concerns such as sexual dysfunctions, lack of desire, or painful intercourse. They reinforce the importance of consent and mutual respect in relationships. By creating open conversations, counseling helps normalize sexual health as a part of overall well being, reducing shame and stigma often attached to these discussions. Social workers are essential providers of counseling in reproductive health. They advocate for clients' rights, empower them to make informed decisions, and challenge inequities. They also facilitate access to services by linking clients with health facilities and welfare schemes. For marginalized group of populations such as adolescents, sex workers, or people with disabilities, social workers provide targeted counseling and ensure inclusion in reproductive health programs. Effective counseling requires strong interpersonal skills, active listening, and empathy help counselors understand clients' concerns and emotions. Building trust and rapport is especially important in sensitive reproductive health matters. Counselors must provide clear and accurate information without jargon, ensuring clients fully understand their options. These skills transform counseling from a one way transfer of information into a supportive and empowering process. Information, education, and communication materials strengthen counseling by reinforcing the messages. Pamphlets, posters, and flip charts are widely used in clinics and community settings. Audiovisual tools such as videos or interactive sessions engage clients effectively. Increasingly, digital platforms provide mobile based counseling reaching youth and urban populations. The choice of IEC tools must match the literacy and cultural context of the audience. Peer counseling is particularly effective in reproductive health, especially among adolescents and marginalized groups. Peer educators provide information and support, leveraging shared experiences to build trust. This approach reduces barriers of age, authority, and stigma. By extending the reach of services into communities and youth networks, peer counseling complements professional efforts and creates sustainable support systems. Family crises often intersect with reproductive health. Domestic violence can prevent women from accessing services, while partner conflicts hinder family planning decisions. Child protection concerns such as neglect or abuse also emerge in these contexts. Counseling helps families navigate crisis by offering emotional support, conflict resolution, and referrals to legal or protection services. By addressing family planning dynamics, reproductive health counseling becomes more holistic. Group counseling brings people with similar concerns together, such as mothers, adolescents, or couples. These sessions provide opportunities for collective discussions, peer learning, and solidarity. Group counseling reduces isolation, helps individuals realize they are not alone, and creates supportive network. For reproductive health, such groups are powerful spaces for changing norms and encouraging positive behaviors. Confidentiality is the cornerstone of reproductive health counseling. Clients share highly personal concerns, and breach of confidentiality undermines trust. Counselors must ensure privacy during sessions and safeguard their records. Ethical and legal obligations guide confidentiality, but exceptions may exist when safety is at risk, such as cases of abuse. Maintaining confidentiality fosters respect and trust in counseling services. Myths and misconceptions are major barriers to reproductive health. Common myths include contraception causing infertility, vaccines leading to sterility. Cultural taboos often silence conversations about sexuality. Counselors must address these sensitively, correcting misinformation without judgment. By creating safe spaces for dialogue, counseling helps dispel myths and empower clients with facts. Technology is transforming counseling. Telecounseling services provide confidential advice to clients in remote areas. Mobile apps offer information on contraception, menstrual cycle, and sexual health. Online support groups they create safe spaces for adolescents and marginalized populations. While technology expands access, digital divides must be addressed to ensure equitable benefits. Counseling men is crucial for advancing reproductive health. Engaging men in family planning promotes shared responsibility rather than burdening women alone. Counseling addresses myths around masculinity, such as fears of weakness from vasectomy or contraception use. By encouraging shared decision making, counseling fosters gender equality and healthcare in families. Survivors of gender based violence require comprehensive support services. Crisis counseling provides immediate emotional relief and safety planning. Referrals connect survivors to legal aid, shelters, and medical care. Long term psychosocial support helps survivors rebuild confidence and resilience. Integrating such support into reproductive health services ensures survivors are not further marginalized. Key populations such as sex workers, injecting drug users, and MSM require specialized counseling. Services focus on prevention, safe practices, and harm reduction. Counselors must build trust through non judgmental care, ensuring confidentiality and dignity. By addressing the unique vulnerabilities of key populations, reproductive health counseling becomes more inclusive and effective. Counseling must confront layered stigma, gender, caste, sexuality, poverty, migration, by using trauma informed, right based approaches that protect anonymity and choice. Practical elements include low threshold access, harm reduction services, and active linkage to HIV testing, mental health care, and legal aid. Peer educators and community navigators are vital bridges, translating a risk message into culturally resonant strategies and improving retention in care. Safety planning, data privacy protocols, and clear grievance redressal protects clients from violence and discrimination, while flexible follow up sustain continuity. Finally, disaggregated, de identified monitoring by gender identity, sexual orientation, drug use, and location keeps services accountable for equity without exposing the clients to risk. Counseling and support services are more effective when delivered through multidisciplinary teams. Doctors and nurses provide medical expertise while social workers address psychosocial needs. Together, they manage case holistically, ensuring continuity of care. This team-based approach reduces gaps and strengthens the overall quality of reproductive health services. Multidisciplinary teams rebalance power by integrating biomedical, social, and legal perspectives so clients are treated as rights holders rather than passive recipients. In practice, joint case conferences, shared care plans, and clear referral counter referral SOPs prevent drop offs between clinic, community, and protection services. Embedding trauma informed, culturally safe and communication and confidentiality protocols allow adolescents, survivors of violence, and marginalized groups to engage without fear. Simple, disaggregated help teams track follow ups and equity gaps, while role clarity and supportive supervision reduces burnout. Finally, including community health workers and peer navigators anchors continuity of care in real life, linking medical treatment, social entitlements, and family support into one coherent client centered pathway. Ethical issues frequently rise in reproductive health counseling. Counselors must balance confidentiality with protection, especially in cases involving minors or abuse. They must avoid coercion, ensuring clients make decisions freely. Respecting cultural beliefs is important, but not at the expense of human rights. Navigating these dilemmas requires sensitivity, ethics, and adherence to professional standards. Ethics is about power. Use trauma informed, culturally safe communication while prioritizing autonomy and voluntary choice, especially for adolescents and marginalized groups. In practice, maintain privacy, obtain assent or consent appropriately, and apply clear, mandatory reporting SOPs for suspected abuse or imminent harm. Documenting rationale and limiting disclosures to need to know basis only. Use structured decision aids to minimize provider bias and explicitly include the option to decline or switch methods without penalty. When cultural norms conflict with rights, practice cultural humility, but escalate to safeguarding protocols and ethics consultation rather than colluding with harm. Finally, regular reflective supervision and case reviews help teams navigate gray zones consistently, protect clients, and uphold professional standards. Counseling services face numerous challenges. There is often a shortage of trained counselors, especially in rural areas. Stigma and resistance from communities make it difficult for individuals to seek services. Limited resources and infrastructure constrain privacy and quality of care. Addressing these challenges requires capacity building, community engagement, and stronger investments in reproductive health systems. These barriers reflect power and exclusion, gender norm, caste hierarchies, poverty, disability, and youth status. So, solutions must rebalance access and voice, not just add services. Practical steps include building a rural counseling workforce through tiered training, telecounseling hubs, and supervised peer navigators, while upgrading clinics for privacy with methods like soundproofing spaces, discreet intake, etc. Communities co-design with women's groups, adolescents, and faith or local leaders reduce stigma and normalize help seeking, especially for contraception, violence, and HIV. Standard operating procedures for confidentiality, consent assent, and referral counter referral makes makes quality reproducible, while dashboards disaggregated by gender, caste, disability, age, and location keep equity in view. Finally, sustained investments, fair remuneration, transport stipends, job aids, and reflective supervision protect counselor well-being and convert policy intent into reliable, dignified care. Strengthening counseling requires investment in training and capacity building. Equipping of providers with the skills in communication, empathy, and confidentiality. Integrating counseling into all reproductive health services ensures clients always have access to support. Strengthening referral networks, linking health facilities, NGOs, and legal services creates a holistic ecosystem of care. These strategies make counseling sustainable and effective. Bangladesh offers a strong example of effective counseling. Community-based workers provide family planning counseling directly in households, building trust with women and families. This approach has significantly increased contraceptive use and reduced fertility rates, improved maternal and child health outcomes, highlight how counseling, when embedded in communities, transforms reproductive health indicators. Door-to-door counseling, what it does? It shifts power towards women by reducing travel, privacy, and cost barriers, and by engaging husbands and mother-in-laws to negotiate support for method continuation. Quality elements include informed, non coercive choice across a full method mix, referral to clinics for follow up or side effect management, and confidential record keeping. Community workers double as social connectors, linking families to nutrition, immunization, and violence response services. So, contraception is framed within broader reproductive rights and well being. Equity improves when outreach prioritizes first time and adolescent mothers, the poorest households, and people with disabilities through flexible timings, respectful communication, and reasonable accommodation. Finally, simple disaggregated dashboards reviewed with community leaders sustain accountability and keep gains in contraceptive use and maternal child health outcomes on track over time. The future of reproductive health counseling lies in expanding digital platforms for wider access, especially among youth. Counseling must increasingly include men and adolescents, recognizing their roles in reproductive decisions. Integrating mental health into reproductive health counseling will ensure comprehensive care addressing stress, anxiety, and relationship issues alongside physical health. To summarize, counseling is not an optional add on but central to reproductive health services. It builds trust, dispels myths, and empowers individuals to make informed decisions. Effective counseling requires trained providers, adherence to ethical principles, and supportive systems that integrate counseling into every aspect of care. Strengthening these services ensures reproductive health is truly people centered. In conclusion, reproductive health counseling is a cornerstone of compassionate, equitable, and effective care. By listening to clients, offering support, and empowering them with knowledge, counseling transforms reproductive health services from clinical intervention into human centered care. As we move forward, investing in counseling and support system is essential for advancing reproductive and child health in every community. So this is all for today. Thank you so much for your patient listening.